COVID-19. It is primarily the continuous review and monitoring of the situation at the highest political and administrative level that has led to decisive action taken in public interest, such as travel restrictions, suspension of visas, and self-quarantine measures. Early establishment of point-of-entry surveillance and universal screening of passengers at airports and vessels at seaports, evacuation of Indian citizens from COVID-19 affected countries, and adequate laboratory and quarantine facilities have contributed significantly towards management of COVID-19 in the country. All essential facilities like community surveillance, quarantine, isolation wards, adequate personal protection equipments, trained manpower, rapid response teams are being strengthened further in all states and union territories. So far, Government of India has evacuated 1,031 persons, including 48 nationals from countries such as Maldives, Myanmar, Bangladesh, China, United States, Madagascar, Sri Lanka, Nepal, South Africa, and Peru. Till date, 819 evacuees from these COVID-19 affected countries have been discharged after 14 days of isolation having tested negative as per protocols. Out of these, 654 evacuees from Wuhan, China on 1st February and 3rd February 2020 were discharged on 18th February 2020. 124 evacuees from Japan and 112 evacuees from China are being discharged from today onwards after having tested negative for COVID-19 in the second round of tests. We have spared no efforts to get our people back from any major COVID-affected country. We have sent scientists, equipment for labs, reagents, and brought back samples for testing from these countries. So far, 1,199 samples have been collected in Iran and brought to India for testing. We have even operated an Air Force flight to bring 58 passengers from Iran on 10th of March 2020. We have facilitated Iran air flight to bring back people from Iran, and today one flight with 44 passengers has landed in Mumbai, and these passengers are being kept in quarantine at the Navy facility in Mumbai. Another Mahan Air flight is expected to land tomorrow in Delhi. We are preparing to operate special flights to bring back Indians who have tested negative and are coordinating treatment of positive people in Iran as per protocol. We have sent a team of 4 doctors from the Ministry of Health to Rome. They have just reached Rome with sufficient material and reagents to collect samples of Indians there for onward testing in India. In addition, we have screened 11,71,000 passengers from 10,876 flights at 30 designated airports. 3,062 of passengers and 583 of contacts were identified, which were referred to Integrated Disease Surveillance Program and designated hospitals. We have brought 42,296 passengers under community surveillance, out of which 2,559 were found symptomatic and 522 hospitalized. 25,504 passengers have been additionally screened at major and minor seaports, and more than 14 lakh people screened at land boats. We now have 81 confirmed cases of COVID-19 in the country. Of these, 3 from Kerala were treated and discharged. In addition, 7 more from Safdarjung have also recovered. Of these confirmed cases, 64 cases are of Indian nationals, 16 Italian nationals, and 1 Canadian national. Contact tracing of these cases is being actively pursued. So far, this has led to identification of more than 4,000 contacts who have been put under surveillance. Death of a 76-year-old male from Karnataka is confirmed to be caused due to comorbidities, that is asthma and hypertension, and he also tested positive for COVID-19. All the precautionary measures as per protocol, such as screening and home quarantine of the contact, has been initiated by the State Health Department of Karnataka and is being closely monitored. It is reiterated that Indian nationals are strongly advised to avoid all non-essential travel abroad and refrain from traveling to countries reporting high cases and deaths as mentioned in our travel advisories. All incoming international passengers returning to India should self-monitor their health and follow the required do's and don'ts as detailed by government. In case of any sign, symptoms like fever, dry cough, difficulty in breathing, etc., please visit a doctor or call the Ministry's 24/7 helpline 011-239-78046. Remember to wear a mask before stepping out to see the doctor. Thank you.
Thank you. Friends, from the Ministry of Home Affairs, Mr. Malik, please add.
Good afternoon, friends. The central government has decided to regulate the international passenger traffic along the land immigration checkposts. We have 37 such checkposts. We have decided, the central government has decided to allow this traffic only through 19 checkposts. The rest of the checkposts would be closed from tomorrow midnight for international traffic. This is to ensure that with the limited checkposts that would be remaining, we can focus on screening of passengers for COVID-19. Secondly, there are certain border haats that are organized in some parts of northeast India on the Indo-Bangladesh border. They'll remain suspended till further orders. Indo-Bangladesh cross-border passenger train and passenger buses would also remain suspended till 15th of April or earlier if so decided. Along the Indo-Nepal border, 4 checkposts would remain operational. Along Indo-Bhutan border, 2 checkposts, Jaigaon and Daranga, they would remain operational. Of course, for Bhutanese and Nepalese nationals, they have a visa-free entry in India that will continue. Secondly, central government also has decided to facilitate the state governments to use the funds of State Disaster Response Fund, SDRF, for fighting the COVID 2019, like funds for quarantine, isolation, treatment, etc., if the state or the NHM funds are not adequately available. Central government has decided to facilitate this use of this fund for this item. Thank you.
Anything you want? From the Ministry of External Affairs, Mr. Ravi, please.
Yeah. Good evening to all, and well, this is just to also just to reiterate the ongoing efforts that our combined efforts that are being put in place. It's on. It's on. So, with regard to the evacuation of Indians, both in Iran and Italy, I think that very strong efforts being made by the mission. Our ambassadors are in contact with Indians there, and their plans are all ready. So, both in Milan, Rome, and in Iran, we are our ambassadors and the missions in consultation and with the help of the local governments are making concerted efforts. Thank you.
Ms. Ravina from Civil Aviation. Would you like to repeat? Take it in the question, Madam Ravina, Civil Aviation Minister.
Good evening, dear friends. In addition to what my colleagues have stated, I just wish to inform that today Iran Air flight carrying 44 passengers landed safely at Mumbai airport, and with the help of all the arms of the government as well as the airport operator, seamless and smooth screening of all passengers, baggage clearance, immigration, customs, and the entire exercise was completed, and thereafter these 44 passengers were shifted to quarantine center of Indian Navy at Mumbai. Similar exercise would be undertaken tomorrow by Mahan Air, and we would expect Indian passengers stranded at Tehran to come to Delhi tomorrow, and they'll be landing at 0148 hours at Delhi airport. In addition to this, Air India is in full preparedness to take another flight if and when required to Iran. Another flight tomorrow, Air India would be taking and sending another flight to Milan to bring back Indians stranded at Milan, and this flight would take off at around 12 or 1 afternoon and would be landing on Sunday morning at 7:45 hours Indian Standard Time at Delhi airport. Thank you.
Friends, now we can take some questions, please. Please use the placard. 15.
ये मेरा सवाल अनिल मलिक जी से है, क्या आप लिस्ट बता सकते हैं कि कौन से लैंड बॉर्डर चेक पोस्ट के ऊपर ट्रैफिक जो है वो अलाउ किया जा रहा है? और ये क्लैरिफाई अगर कर पाएं कि करतारपुर कॉरिडोर जैसे जो हैं उसके ऊपर क्या फैसला हुआ है? करतारपुर कॉरिडोर ऑन रहेगा या बंद कर रहे हैं आप?
अभी जहाँ पे क्रॉस बॉर्डर मूवमेंट दैट इज़ ह्यूमन ट्रैफिक, इंटरनेशनल ह्यूमन ट्रैफिक जहाँ अलाउड है, वो हैं आसाम में मनकच्चार एंड सूतरकांडी, दैट इज़ इंडो बांग्लादेश बॉर्डर, बिहार में रक्सौल इंडो नेपाल बॉर्डर, मेघालय में दालू एंड डॉकी, दीज आर बोथ इंडो बांग्लादेश बॉर्डर, मिजोरम में क्वारपुचिया एंड जोगथार, जो क्वारपुचिया इज़ इंडो बांग्लादेश बॉर्डर एंड जोगथार इज़ इंडो म्यांमार बॉर्डर, त्रिपुरा में अगरतला इंडो बांग्लादेश, उत्तर प्रदेश में सोनौली इंडो नेपाल बॉर्डर, उत्तराखंड में बनबासा इंडो नेपाल, वेस्ट बंगाल में चंद्रबंधा, ये सारी इंडो बांग्लादेश वाली हैं वेस्ट बंगाल, कूच बिहार में चंद्रबंधा, हिली, फूलबारी, गोजाडंगा, हरिदासपुर, गेडे, चितपुर, रानीगंज भी वेस्ट बंगाल में है इंडो नेपाल पे, उसमें भी ट्रैफिक अलाउड है, जयगांव ये इंडो भूटान बॉर्डर पे है वेस्ट बंगाल, एंड दरंगा ये आसाम में है इंडो भूटान बॉर्डर पे। टोटल 19 चेक पोस्ट्स हैं जहाँ से इंटरनेशनल पैसेंजर ट्रैफिक वुड बी अलाउड फ्रॉम 00 आवर्स टुमारो नाइट।
25।
जो अपडेट हुआ मेरे ख्याल से शायद 5 नए केसेस आए हैं, ये कहाँ पर हैं, किस स्टेट में हैं, इनके बारे में कुछ बताएंगे?
देखिए, जो अभी मैंने जैसे आपको बताया, टोटल 81 पॉजिटिव केसेस अभी जो डिक्लेयर हुए हैं, तो इसमें इनका एक स्टेट वाइज डिस्ट्रीब्यूशन है। तो जिसमें शॉर्ट में अगर मैं आपको बताना चाहूँ तो जैसे केसेस हमारे पाए गए हैं दिल्ली में, हरियाणा में, केरला, राजस्थान, तेलंगाना, उत्तर प्रदेश, लद्दाख, तमिलनाडु, जम्मू कश्मीर, पंजाब, कर्नाटका, महाराष्ट्र एंड आंध्र प्रदेश में, तो इन स्टेट्स में पाए गए हैं अभी तक। जो लेटेस्ट ऐड हुए हैं, अगर उनमें देखें तो आंध्र प्रदेश से हैं, नेपाल, कर्नाटका से हैं, केरला से हैं और दिल्ली, यूपी, इन स्टेट से पाए गए हैं।
156।
Sir, I'm Joymala from.
156. Please just let her ask.
Sir, I'm Joymala from ANI. Sir, I just wanted to ask, like, we have seen exorbitant rate of masks that's been sold outside, and also there is the sanitizers are coming in which are coming in the market are of low quality, may be of duplicate quality as well. So, how ministry is taking that on note?
See, there are two aspects to it. One is that our do's and don'ts clearly identify and have explained that hand washing by soap also is sufficient. So that is one aspect. Second is we have also indicated that we where and who should wear masks. So masks need not be worn by people in general. The point which I reflected yesterday also, that we need not panic. We should follow the guidelines which have been issued by government, the risk communication material which has been issued by government. Linked with that is the fact that if any exorbitant price will take place, we have already requested all the states to take action as per the law, and there is also a thought process that if need be, we will take even drastic actions for abnormal increase in prices, as and how we will see that how the situation is emerging.
13.
The day before, Epidemic Act was invoked by the centre. What exactly, could you please specify what exactly does it mean and how will it help centre tackle the outbreak?
Okay. As my colleague just mentioned that, Disaster Management Act is also provided, and under the SDRF, the officials can now draw money and can take up the activities. I would just like to highlight that, first very important aspect to understand is that it is not a health emergency. I think there was some misnomer, some misunderstanding created for some reason that it is definitely not a health emergency. When we talk about Epidemic Management Act, then we are primarily trying to support the initiative taken by the state in terms of management of the situation. I would just like to read out the letter which Secretary Health has actually written to Chief Secretary, which will primarily indicate what we are trying to, work on. So it is that as part of our management efforts, there is a need to impose certain social distancing measures, such as quarantine of exposed healthy individuals who could be potential patients or isolation of those with symptoms. Such measures required great persuasive communication. The persons to be quarantined or isolated need to volunteer for such measures in greater interest of the nation. There might, however, be cases where in large community interest, we may have to issue instructions to non-cooperative individuals. And that is what we have highlighted, that in case of non-cooperative individuals, these acts will empower state, and I would just like to read out the last statement. As states get empowered under the Epidemic Disease Act and under other provisions in our public narratives, it is important to make it clear that there is no epidemic of COVID-19 in the country. All such actions are primarily legal empowerment for the preventive action that requires to be taken.
35.
Hello, sir. So, with regards to one of the patients' new cases that has come up in Delhi, okay, there has been reports that she's an elderly woman who's in a critical condition, okay, and also that she contacted the disease from her son, and he was traveling in the metro quite often. So in this regard, can you comment on the elderly woman, one? And second, with regards to the Delhi metro, is there a cause of concern that the government has, and is it going to take any steps with regards to it?
So let me respond by saying that first, we would not like to discuss individual cases because we would like to maintain privacy, and we'll try to focus our efforts primarily in terms of management, what needs to be done at the field level. Having said that, yesterday also I had highlighted, so it is important that people should focus on three aspects, majorly three aspects. One is hand hygiene, second is respiratory hygiene, third is social distancing measures. And this is also applicable when people are traveling in public transport. Metros and all other related public transport related departments have already been advised to ensure that there is proper sanitization done in all such facilities, as well as also community being made aware that required social distancing be done.
155.
Yes, sir. My question is related to what is our preparation related to testing of samples. So basically, we want to know how many samples has been tested from how many individuals, and how many testing kits are available currently now, and how many persons are engaged in these activities. So broadly, what is our preparation related to testing of samples?
I thought sir is going to answer this. Just few things which I would say. Currently we have close to about 32 labs which perform either of the tests. No, there are two tests which we have to perform, which will be scaled up to 52 perhaps by next week, midweek, and then remaining labs, which are about 52 labs, 56 that are remaining, they will continue to remain as collection centers. Today we made another effort that by midweek, which I promised as a figure of 52, should become 65. We are enrolling other labs into the network as such. Now, with respect to how many tests that we can perform as of now, we can perform 100,000 tests, as I said earlier, even today, without any botheration. We have ordered reagents worth 200,000 tests as of now. So, to me, testing capacity is not an issue. We hope we continue to remain in the same state, that we have reagents ready and not many tests to be done if our interventions, which are very comprehensive, are in a position to contain this outbreak for a sustained period.
I would just like to add, when it comes to the issue of how many labs are there, it is also important that we need to, through you, make community aware that there is a proper protocol, there is a proper case definition only when the samples to be taken. People need not panic. It is not an epidemic, as I highlighted. Government is fully aware of what are the tasks to be done. What we request primarily, that if you have any symptoms and any contact history, kindly let us know. Based on the case definition, if samples need to be taken only, then they should be taken.
62.
This is already mentioned, the number of testing kits has already been indicated.
Good evening, sir. This is Rajesh from the Wall Street Journal.
wanted to understand who are the potential targets for home quarantine and compulsory quarantine at government designated centers. For example, an Indian student coming back from US doesn't have any history of having visited any of the 7 high-risk countries, is asymptomatic while screening. Will he be allowed to go home or suggested home quarantine and left to his wisdom to report any of the symptoms he develops later? And secondly, how many Indians, including students, are stranded in Italy and are okay who want to come back to India?
Okay, so as far as the home quarantine is concerned, kindly we would request all of you to kindly go through the travel advisories issued by government. First, what we have requested everyone is that kindly avoid non-essential travel. Second is that if you are traveling to any of the countries, and while we did indicate list of some countries, but as you are also aware that the list is also a dynamic list in terms of the fact that the other countries where larger cases do get reported. So our general advice to everyone is that once you come back, kindly have self-monitoring, follow do's and don'ts, and parallelly ensure home isolation, particularly if you have come from countries where larger number of cases have been reported. So this is a home quarantine related advice we have given generally to people who have done international travel, and if they have any symptom, get in touch to us through our call center, through the district surveillance network also, so that we can follow them. Particularly with respect to the fact that if someone has come from US and he is asymptomatic and he has no travel history. So what we need to appreciate and understand is that when the screening gets done at the airport level, that time based on the symptoms, based on the clinical history, based on the country they have visited from, or having any contact history, based on that a decision will be taken by the health staff available at the airport and suitable guidance will be given to the person concerned.
33. Please just wait for that. Yeah, I think you want to add something. Just please wait. 33. Just wait. Yeah.
I think the question on Italy. See, these students are quite dispersed. You know, they are around many places in Italy, but I think priority is right now Milan, where our students are stranded in and around Milan. So the number that we are getting in consultation with our ambassador and the consul general in Milan is about 220 or so. So that's our priority to bring them. But subsequently, I'm sure, and we will look around if there are any other students who are left behind, and they will be advised to contact our missions, and we will aggregate that number and see what next we can do about that. So far, we have not got any request from any student from there, but we will check with our ambassador and find out. Thank you.
Yeah, 33 please.
सर 81 जो हॉस्पिटल में अभी हैं पेशेंट, उसमें उनका हेल्थ कंडीशन क्या है, कितने लोग आईसीयू में हैं, कितने लोग वेंटिलेटर पे हैं, और मैक्सिमम हॉस्पिटल स्टे इनका एक पेशेंट का कितना है मैक्सिमम जो अभी तक का है?
देखिए, जैसे मैंने आपको बताया, सारे पेशेंट अभी क्लिनिकली स्टेबल हैं. नन ऑफ द केसेस आर एट रिस्क राइट नाउ. ओके, 3 पेशेंट पहले डिस्चार्ज हो गए थे. 7 पेशेंट आफ्टर सेकेंड टेस्ट ऑल्सो दे आर फाउंड टू बी नेगेटिव एंड दे विल बी डिस्चार्ज सून. So as of now, there is no cause of worry. Only case which was actually having comorbid conditions, and which is what I indicated, was found tested positive later on, is the only case presently which we can say is in the disease category. That's it.
152.
Excuse me, sir. About the total number of cases which you shared is 81. I want to know 3 cured case and 1 death case is also included in this, or it's separate?
It is included.
Included. So it's 81, not 85.
No, not 85.
Okay.
And let me also highlight, which is very important to understand. See, as far as this case which I talked, which is found to be disease case, you all need to appreciate that this case was actually having comorbid conditions which I indicated, asthma as well as hypertension, and he was 76-year-old person. And he had travel history to a particular country for more than 1 month. When he had gone to private sector for treatment, and during the private sector treatment also, as a precautionary measure, when his condition deteriorated, he was actually his sample was taken on 9th, and subsequent to that, our district hospital team, the district collector of that district, we all followed it up, but they did not heed to the advice of the medical professional to get admitted into the government facility. And I need to highlight this point particularly because, see, all we need to understand is that this whole effort by government is primarily to help us to help you. And we would like to take your help in spreading this message forward, that kindly help us. In this particular case, when the person was in a hospital, against the advice of the medical professional, the family took away the patient. and he never approached government facility. Even though he was advised, he was followed up also. So it is important that kindly be aware what are the guidelines which are issued by government, kindly be aware what are the do's and don'ts we are prescribing, and always remember that your efforts and our efforts are combined in the direction that we need to coordinate with each other, we need to cooperate with each other, and we also have to ensure that we are working on 3 P's primarily: protect yourself, protect your loved ones, protect your community.
Yeah, 38.
So 2 questions. First, if we could get some clarity. So this is being reported in 2 different manners. The 707 employees of the person who's been recently diagnosed, the Delhi resident who used to work in a Noida factory, it's being reported that 707 employees of that factory are under observation. That's in some reports. Other reports say they are under isolation. Could you clarify whether they're just being monitored at this moment or 707 people are under home quarantine?
So as I mentioned, of all these positive cases, we have identified more than 4,000 contacts under tracing, which would not imply that every employee of an organization who has had contact or who had secondary or tertiary 3rd level contact, they will be treated as contact. Most of them may be even proposed for home isolation and self-monitoring. It is only people who are the 1st level contact and who are shown symptoms, we probably sort of treat them as the 1st level contact and monitor them much more seriously.
26.
On the evacuations which are going to happen over the weekend, if you can talk about that. Also, one more clarification, is the Kartarpur corridor, is it open or is it closed?
I will just repeat. Tomorrow we are having one flight from Tehran which would be carrying Indian passengers to Delhi. This would be Mahan Air, and it would land around midnight tomorrow. Then in addition to this, one Air India flight, it is in complete preparedness. As and when it is required, this can be deployed to Tehran to carry other Indian citizens stranded there. Then one more flight will be flying tomorrow around 12 or 1 afternoon. That will be going to Milan to bring back our Indian citizens stranded there, and it would land on Sunday morning.
39.
Regarding, regarding Indo-Pakistan border, the matter is still under consideration.
39, please.
So my...
Please just...
The status quo prevails. Obviously.
Please, 39. I think please just wait for the, someone is waiting for the question. Low cross.
So my question is that...
please, it will be clarified.
So my question pertains to this tweet that was received by Mr. Dhumu Ravi from a seaman from Bushehr Hotel. 22 of them, they said, have been waiting for a response from the Ministry of External Affairs. And you had given a response to that person saying that talk to your employers, ask them to look after you, adopt all safety precautions. You have access to Twitter, which means you can look after themselves. So are you also going to look at rescuing these 22 seamen? And this is a complaint that's come on Twitter that you have replied to. So is there anything that you're currently doing?
I think there's some mistake. I didn't tweet, so I don't know where you saw that. But let me get back to you on that later.
Even earlier question also, we have noted your point and it will be conveyed to you. Now it is 31.
सर, जैसा आपने जानकारी दिया कि 19 चेक पोस्ट ही ऑपरेशनल होंगे कल मिडनाइट से, इन चेक पोस्ट पे जो आने वाले लोग हैं उनको चेक करने की क्या व्यवस्था है? कैसे आप इनको डिटरमाइन कर रहे हैं कि ये पॉजिटिव है, निगेटिव है, इनको क्वारंटाइन में भेजने की ज़रूरत है, इनको एंट्री देनी चाहिए या नहीं देनी चाहिए? दूसरा, जो बस सर्विस की आपने बात कही, उसके बारे में स्पष्ट करें कि ये कब से कैंसिल हो रहा है और कितने दिनों के लिए इसे कैंसिल किया जा रहा है?
बस सर्विस का जैसे मैंने बताया कि 15 अप्रैल तक, और ये भी टुमारो नाइट 00 आवर्स से इफेक्टिव होगा, 15 अप्रैल तक सस्पेंड रहेगी। जो चेकिंग की आपने स्क्रीनिंग की बात की, जो हम जैसे एयरपोर्ट लेवल की जो स्क्रीनिंग है, उसी लेवल की स्क्रीनिंग जो इमिग्रेशन चेक पोस्ट अभी खुले रखे हैं, लैंड चेक पोस्ट, उसी लेवल की स्क्रीनिंग वहाँ भी होगी।
32।
सर ये जानकारी चाहिए थी कि अब तक जो नए मामले आए हैं वो किस राज्य में कितने हैं, जो 6 या 7 मामले आए हैं, और दूसरी बात यह है कि कितने टेस्ट अब तक हो चुके हैं भारत में।
देखिए, जैसे मैंने आपको बताया था कि आपको मैंने जिस जिस स्टेट में केसेस आए वो पूरे बताए हैं। अब ये कल से आज में कितने केस आए, वो कितनी स्टेट में आए, वो क्लासिफिकेशन में अभी शायद आपको नहीं दे सकता, आपको चाहिए मैं बाद में दे सकता हूँ। हाँ, दूसरी चीज़ है कि नंबर ऑफ टेस्ट के लिए डॉक्टर साहब आप बताएंगे एक बार टोटल।
At this point in time, it's close to about 6,500. I may be 50 plus, 50 minus. If you want exact number, I can give you later. 6,500 के नज़दीक टेस्ट हुए हैं।
ठीक है, बिल प्रोवाइड। Yes, 14 please.
Does Delhi have 7 cases so far right now? Because from 75 to 81, 5 new cases.
Delhi has total of 6 reported cases so far.
So where are these new cases from? Because you mentioned Delhi among the 5 states which you have mentioned.
Ma'am, you have asked me question कि कल से आज तक में कितने
From
cases आए हैं।
75, 81, it has risen to 81.
Let me just kindly respond. You asked me कि कल से आज में कितने cases आए हैं. Then I had not brought the data कि कल से आज में जो cases आए हैं वो किस state से आए हैं specifically. I have given you some states where the cases have been reported.
So you mentioned
last few cases. तो इसलिए मेरा एक रिक्वेस्ट है, जो जैसे कि कल डॉक्टर गंगा खेड़कर साहब ने भी बताया था, इंडिविजुअल केस और इंडिविजुअल नंबर से ज़्यादा इंपॉर्टेंट हमारे लिए है कि जो भी केसेस हमारे आए हैं हम उनको ढंग से ट्रीट कर पाएँ, साथ में उनके कॉन्टैक्ट्स को ढंग से ट्रेस करके फॉलोअप कर पाएँ।
अभी एक थोड़ा क्लैरिफिकेशन, जब हम सवाल पूछ रहे हैं कहाँ कहाँ केसेस आए, ये कितना इम्पोर्टेंट रहेगा, अभी इस वक्त उसकी लिमिटेड इम्पोर्टेंस है। रीज़न क्यों है? क्योंकि जो बाहर से ट्रैवल होके कहीं सिटी में आ रहा है उस जगह पे ही केसेस दिखेंगे। ये जगह का जब इम्पोर्टेंस कब आएगा, जब कम्युनिटी में ट्रांसमिशन खुद का खुद शुरू हो जाएगा, तो वो पूछना कि वो एरिया में इन्फेक्शन गया क्या, ये इन्फ्रेंस निकाल सकते हैं। लेकिन ये तो ट्रैवल हिस्ट्री, यानी अब दिल्ली में समझ लीजिए ज़्यादातर ट्रैवल करने वाले आते हैं, समझो 20% लोग दिल्ली में आते हैं, तो आपको इन्फेक्शन उनकी वजह से हुए वाला दिल्ली में दिखेगा।
Number 5.
Question is to you, Mr. Malik. Clarification, you said the bus services and the rail services with the Bangladesh stand suspended from tomorrow night. Okay, the second question is, have you seen a drop in the number of people who are registering for Kartarpur Sahib visit? They have to register a week before or 15 days before. Go.
I am sorry, I don't have the data regarding Kartarpur, so I can't comment on the trend. Generally, the trend had been like a few hundred, 300 to 400 people on the weekdays, and on weekends it was double the normal traffic. So right now I don't have the data. And regarding Indo-Pakistan border, as I said, the matter is under consideration. Yes, train is included, both, yes, passenger train, not goods train, passenger train and passenger bus. Yes.
Last question, 28.
So, sir, this question is about the press conference which Pinarayi Vijayan, the Kerala CM, did yesterday, and he said that 65 people yesterday were admitted, and we have seen a rise in Kerala and both the states, Maharashtra and Kerala. What is the situation right now there? How is the ministry monitoring that?
So as I mentioned, see, all the cases get monitored as per the overall management plan which is there for a positive case to be found, and each case get monitored with respect to their contact history. Subsequent to the contact history, once all these cases get monitored, then we also, based on their symptoms and their level of contact, monitor and take their samples also, and everyone gets followed up to the logical conclusion. What is very important to understand is that when all these cases are coming, they are also linked with the travel history and all those type of issues. So positive thing so far is that we are seeing some travel history cases and some local transmission in terms of affecting family and close relatives. So right now, if we are able to work collectively in terms of breaking this chain of transmission, I think we will be in a very comfortable position. And all cases get monitored logically till the logical end. As I mentioned, 4,000 contacts are getting monitored. Let me also through you once again request, it is very important for people to kindly be aware. Do not get panic, but be aware. It is an infectious disease. This has to be managed. Once we are aware, once we know what are the precautions to be taken, then it is a easily manageable disease, though it is infectious, but mortality in this particular disease is rated world over to be very low. So it is very important that as and when people have symptoms and they have contact history or the travel history, kindly get in touch with government, follow with respect to the protocol which is there, and we will be able to manage those cases, which is what has been indicated by all the positive cases which have come in the country so far.
Thank you very much. Friends, we are issuing a detailed press release.
Sorry, one second.
Just 1 minute.
1 second, please.
Yeah, please.
Ma'am, regarding your question, I have the data for today. This is 357 people for today, Kartarpur.
Whatever questions you are asking, we are issuing a detailed press release. We will ensure that the information.
No decision has been taken regarding that. Yes.
Thank you very much, friends, and we are issuing a press release also. You will get these details in the press release as well. Thank you very much.